founder of Kinsa. With me on stage is my colleague, Zach, who's going to play the role of both father and son in our product demonstration. And I also want to say this is Zach's first day of working at Kinsa, so we're really excited to have him. Imagine what we as a society could do if we could track the spread of disease in real time. For those of you scratching your head saying, can't we do that already? The answer is no, we're not even close. So 2 years ago, we started Kinsa with a mission to create the world's first real-time map of human health to track and stop the spread of disease. We thought to ourselves, how can we begin a communication with someone who has just fallen ill to give them value, to help them get better faster, while at the same time collecting information to map human health. So to do that, we reimagined and revolutionized the world's most common medical device. This is the world's smartest thermometer. I'm very excited that it got FDA approved about a month ago, so we're just launching it. So I'd like to show you how it works. Zach is going to demonstrate, and he's going to be using an optional extension cord for demonstration purposes. Imagine that your 5-year-old has gotten ill, so you take the Kinsa Smart Thermometer out and you take his temperature. So as you can see, we've created a fun, engaging screen for both parent and child. Zach's going to show you the gravitational effects of the bubbles as he's taking his temperature. And he's got a reasonably average temperature. He's a little cool, but for those of you that don't know, everyone has actually a slightly different set point in terms of their temperature, and this is one of the kind of devices that you can use to track that as well. So you can know if you have an infection a little bit better perhaps than other thermometers. So you saw during that screen that it not only was engaging, but we showed progress along a temperature reading. We actually show if it falls out of your mouth, and there's other things that we can do because of a smartphone that you can't do with an ordinary thermometer. So Zach's going to show you that with a few simple taps, you can track your symptoms over time, and even share that with your spouse or with your pediatrician. When you go to the pediatrician's office and they ask, what was the temperature and how did symptoms progress over time? Now you have your phone in your pocket and you can pull it out and you can show them right then and there. So you see that your child has a generally okay temperature but it's exhibiting some symptoms. You're concerned that they're getting sick from somebody, probably another kid, so you go and check the health at your child's school. Here you see the private group that you joined with other mothers of your child's first grade class. You see that 4 out of 24 kids are ill and strep throat's going around. So that causes you concern, so you look for the nearest urgent care facility with an appointment. And this is the kind of triage functionality that we can provide through the app. So even if you haven't joined a private group, you can see the local health situation. Here you see it on a map. And this is a picture of San Francisco. We only have some beta testers, so this is fake hour data with lots of other data from the CDC and else. And you can see that the Mission District is not looking so good. I don't know what the startups out there are doing, but not looking so good. And so this is a more descriptive picture of the Mission District. This is what we like to call the health weather. This is what we're trying to do. We're trying to give you a real-time understanding of what's going around, to empower you with the information to make decisions. So that's a bit about the product. Earlier we said that this was the world's smartest thermometer. We also know that it's one of the world's least expensive thermometers. So we've used, and now the reason for that is we've used the smartphone intelligently. So we're using the display, the power, and the processing capabilities of the smartphone. That means that there's no batteries, there's no LCD, there's no processor required in the actual thermometer. And this is the actual PCB board. I know it's so small you guys can't see it. But it's tiny, right? There's 6 resistors and a capacitor. For those of you that are electrical engineers, there's nothing to it really. And it's really all the processing power on the phone. In addition to it being cheaper than most thermometers and smarter than most thermometers, we also think of it as one of the most beautiful thermometers ever made. And it comes in this really cool case, which I don't have with me. It's sitting down there. I'll show it to you in a moment. And the actual design of the product, because it's so small and there's nothing to it, it can be highly, highly flexible, which is really comfortable, especially for kids. So that's the product. And so you may also be asking yourselves now, how did you come up with this idea? So I'll tell you the brief story about that. In 2011, I fell really, really ill. My fever would not go below 104, despite medicines, and I failed 2 antibiotic regimens. And I was delirious. It was the 6th day and I was delirious, so I started searching online, looking around, doing Google search queries, checking social media mining, and started thinking to myself, somebody else has to have this illness because it was clearly an infectious disease. It was flu-like symptoms. Maybe they can tell me how they got better. And I found zero. And it struck me that even in the greatest country in the world, even in this highly connected society in which we live, we're still in the dark ages when it comes to understanding the health situation around us. And that's despite so much rich, real-time access to other data for other aspects of our lives. I can't live without Google Maps and Waze today. In fact, I used it to get here, as I bet many of you did. And yet I have zero access to this most important aspect of our lives, the health in our communities. Now I was very fortunate. At the time, I was working at the Clinton Foundation and had been working in public health for a long time. I had the really great pleasure and honor of being the guy who brokered the deals that President Clinton announced on lower-priced AIDS and malaria drugs overseas. So clearly I was in the industry, right? And it got me thinking about this problem in a much deeper way. I thought to myself, well, I couldn't find information, but there's got to be something out there. There's got to be something out there to track the spread of disease in real time. And what I uncovered was very interesting. So a little bit of context. 90% of the 7 billion people on the planet are affected by infectious disease each year. It's certainly, whether that's strep throat or the flu or something far more serious than that, TB, malaria, HIV, etc. And with that, we spend trillions of dollars on trying to stop the spread of infectious disease, trying to treat it, trying to prevent it, etc. Despite that, there's really not that much out there. So what I found, I started with the basics. I looked at the 2 most prominent healthcare organizations in the world, the World Health Organization and the United States Centers for Disease Control. And I looked at them and I thought, what do? You've got to have some sophisticated means to track the spread of disease. What I found was that the gold standard was physician-reported illnesses. So in the United States, the U.S. Centers for Disease Control has this system where they try to get doctors to report illness. It's very sparse, and one thing that I uncovered is that by the time they collect data, aggregate it, and can actually visualize it, it's 4 weeks after the fact. 4 weeks after the flu season has started, everyone in that area is already affected by the flu. So, it's not really a real-time system, but certainly has very high, as they would say in the data world, signal to noise, right? It's accurate because physicians are reporting. So, I thought, okay, that's interesting. Seems a little primitive. We've got all this technology. There's got to be something else. So I uncovered this really cool and really innovative idea from Google. This is called Google Flu Trends. What Google's doing is they're taking search query data, data from people still in their homes before they enter the healthcare system, because everyone uses Google, and they're mining the search queries to find flu-like terms. And that's how they're developing an interesting big data perspective of the flu. So really insightful, huge leap forward. Now the problem with this, and there's a few problems with this, one of them is that your browser's not super geolocated, so they can do it on a regional level, but they can't do it more than that. And much, much more importantly, is you have these challenges with mining the data. So, as you can see here, I have a fever. Obviously, that's an indication of some sort of illness. However, if you have Bieber fever, it may not be. And so that's the kind of challenge that you see with natural language processing. So this idea has been extended. So it's not just Google search queries that are doing this now. Now you're also mining social media. Again, you still have the same kinds of challenges. A lot of people tweet from their phones, so it's generally a little bit more geolocated, but you still have these natural language processing and signal to noise errors. This was the state of the art when we started, and really innovative, insightful things. And we thought to ourselves, well, there's got to be more you can do, because what's missing from the equation, what's fundamentally missing from the equation, is real-time, highly geolocated, medically accurate data. With that data, you can probably draw a lot more insight from Google, a lot more insight from the social media, and do a lot more things with the CDC data. But that was the fundamental missing part. And so that's where we came up with the thermometer. So some of you may still be asking yourselves, so I don't get it, the thermometer. I don't really get it, right? So, what we showed you earlier was what we believe is a beautiful design that people will use that will allow us to get real-time geolocated fever data, symptom data, and we're reimagining what a thermometer is. So just like Apple started by recreating the phone And oh, by the way, for those of you that don't know, talking on the phone is now number 5 on the list of how you use a smartphone. Number 5. It's no longer a phone, right? And that's the same idea with a thermometer. We're extending the meaning of it. The first thing that a parent in particular does when they find that their child is ill, after comforting them, after if they're of an age that they can speak, talking to them about their symptoms, is they take out, the first gadget they get out is the thermometer. So we're piggybacking off of that idea, and we're extending the meaning to give you help. But the key point here is that we're leveraging an existing behavior. We are piggybacking off the most widespread medical behavior in the world. A parent taking a child's temperature at the earliest that child is exhibiting an illness. And I'll add 2 or 3 points. Children for those of you that are parents, you know that children are germ machines. Children happen to be the primary vector, vector is not the appropriate word, the primary spreader of most infectious diseases, especially in Western society. So if you know what's happening in the children population, you can predict what's going to happen in the broader adult population about a week later. That's a simplified view of it, but that's one key point. And so that's one of the reasons that we started with the thermometer. The other point here is that parents happen to be power users of existing thermometers, so we wanted to create a better product. So that's the story behind the thermometer. And now we've shown you a little bit about how we can potentially track, as long as we get widespread uptake of the product, how we can potentially track the spread of things like flu. But there are also more devastating diseases that we can potentially avoid. So let's see here. There we go. What you see up here is a list of 3 dozen epidemic diseases that all had pandemic potential in the last 30 years. So each one of these diseases did or could have killed between 1 million and 10 million people. These all had pandemic potential. And there are some of them that have been big global scares, even in recent years. So many of you are aware of SARS and swine flu. I bet many of you were not aware of the 1918 Spanish flu, which affected nearly 1 in 4 people globally and killed 1 in 6 infected. That year, which was the first year of World War I, and a lot of people attribute many of the deaths globally to World War I, and that's true, but a lot of people died from the Spanish flu. One strain of the flu killed massive numbers of people globally. So that's the kind of thing that we can also work on, is trying to avoid and trying to early detect and early respond to pandemic threats. So with that, I'll just quickly summarize. What we've built, we believe, will help transform the way that parents take care of their families. We've built a product that we believe will help transform the way parents take care of their families. And we're building a system where crowdsourced data, your data, will help to save lives. Join us, and together, let's revolutionize health for 7 billion people, starting right here in the United States. Thanks for your time. Medical device. This is the world's smartest thermometer. I'm very excited that it got FDA approved about a month ago, so we're just launching it. So I'd like to show you how it works. Zach is going to demonstrate, and he's going to be using an optional extension cord for demonstration purposes. Imagine that your 5-year-old mission to create the world's first real-time map of human health to track and stop the spread of disease. We thought to ourselves, how can we begin a communication with someone who has just fallen ill, to give them value, to help them get better faster, while at the same time collecting information to map human health. So to do that, we reimagined and revolutionized the world's most common My name is Inder. I'm the founder of Kinsa. With me on stage is my colleague Zach, who's going to play the role of both father and son in our product demonstration. And I also want to say this is Zach's first day of working at Kinsa, so we're really excited to have him. Imagine what we as a society could do if we could track the spread of disease in real time. For those of you scratching your head saying, can't we do that already? The answer is no, we're not even close. So 2 years ago, we started Kinsa with has gotten ill. So you take the Kinsa Smart Thermometer out and you take his temperature. So as you can see, we've created a fun, engaging screen for both parent and child. Zach's going to show you the gravitational effects of the bubbles as he's taking his temperature. And he's got a reasonably average temperature.